Welcome to Pregnancy and Birth Diaries. Today I want to talk about abortion. In this video, I will be using a medical term, pregnancy tissue, although I personally do not like using such terms. I usually prefer calling it what it is. It's a human life and it's a baby, but we'll be going through a medical process, and for my own sanity, I will be using suggested medical terms. And also, whether you are hesitating or already made the decision, I believe you thought through it and I respect your decision. I believe every woman has the right to decide whether you are pro life or pro choice. It's your decision and it's your life. And if you decide, then it's not my place to tell you what to think or what to do or what to believe. Now, that is out of the way. Let's dive right in. There are two types of abortions: surgical abortion and chemical abortion. First, let's talk about chemical abortion. It's also called a medication abortion. It's a non-surgical method, and it is usually used to terminate pregnancies using only medication. And it is only recommended for pregnancies in early stages, something between up to 10 to 12 weeks. And it involves two medications, depending where you are in the world. The brand names, types can be different. So essentially, the first medication is given to block the hormone progesterone because, as you know, our body releases a lot of progesterone, especially in the beginning of our pregnancy, to enable the healthy growth of our baby. And very low level of progesterone stops the pregnancy from progressing. And the second medication is taken 24, 48 hours later, and it induces contractions and labor, and then pregnancy is not there anymore. Or to call it in medical terms, the pregnancy tissue is expelled from the body following the contractions. So, what's the process and timeline? Day one, the first medication is taken in a clinic or at home, depending on the regulations. And then 24, 48 hours later, the second medication is taken, which leads to cramping and bleeding. Next few days, bleeding continues, which is similar to heavy period when your body is expelling the pregnancy. And then 1, 2 weeks later, it is recommended to do a checkup to make sure everything went well. This method is 99% effective when done correctly within the recommended time frame, which is 10 to up to 12 weeks. What are the risks? One of them is a rare complication, and it's an incomplete abortion, which means that not all pregnancy tissue leaves the body and it requires further treatment. There might also be infection. This method is, by the way, not recommended for ectopic pregnancies or certain medical conditions. Now let's talk about surgical abortion. There are usually three types of surgical abortions. The first is manual vacuum aspiration, MVA, which is recommended for pregnancies up to 12 to 14 weeks. It uses gentle suction to remove the pregnancy, and the procedure lasts 10-15 minutes depending on the situation. The second method is called dilation and curettage, DNC, and this is for pregnancies up to 16 weeks. It involves dilation of the cervix and removing the pregnancy tissue with suction and also instruments. The third method is dilation and evacuation, DNE, and this is for a bit later stages of pregnancy, about after 16 weeks. It's a more advanced procedure because it's used in second trimester. And of course, for surgical abortions, most of the time anesthesia or sedation is offered. And also, for later stages of pregnancy, abortion doesn't happen in one day. You will have to take the medication for dilation 1 or 2 days in advance, but your doctor will explain everything in detail. I personally believe we women, we know what's best for us. It's hardwired into us to be a mother, first of all, to care and have unconditional love for our child and to provide the best we can. So I believe for whatever reason you decided to have an abortion, I believe that you thought through it and you have the right to do so. I personally have never been in that situation, so I don't know what it's like, and I don't judge anybody who decides to go in that path. Having said that, it's important to realize that when doctors use terms like pregnancy tissue, or when they say termination of pregnancy, or stopping the pregnancy, we are actually talking about a human life. We're talking about a little baby. It's important to fully realize that and not let yourself be misguided with medical terms. There's nothing worse than coming into realization later on when it's too late. So if you decide to go for abortion, be fully informed and do it with clear head. And then, it's your decision, and everybody should respect it. Now, if you are in doubt, try to see a consultant. There are usually government sponsored centers. For example, in Germany, we have advisory centers where you will be shown what options you have if you give birth. And they walk you through what financial benefits and health insurance plans you might be eligible for. And they can also answer your questions regarding abortion and address your concerns. Obviously, such places are not available everywhere, depending where you are. You can find such state sponsored clinics, or maybe you can find community built groups, or maybe even some sort of like non-profit organizations that can help you. You can also check on Facebook. There might be some social groups where they help each other. I'm sure you already know this, but in case you do not want to go with abortion, you might want to consider also adoption, or keeping and raising your baby. Whatever you decide, it's your decision. Having said that, if you trust the father of the baby and you feel safe with him, make the decision together, and do not feel discouraged to talk to your parents, especially to your mother. If you know that she loves you and cares for you, talk to her. If you feel safe and good talking about it to your friends and family, get as much support as you can. And as always, make sure to talk to your doctor for any medical advice. Okay, that's it for today. Thank you for watching, and I will see you next time.